My name is Alexander Bendayan. I'm the chair of the Department of Prosthodontics at Nova Southeastern University, College of Dental Medicine. Well, I had a history of education and implementing technologies in education. To me, setting the bar high is the most important, and technology is one important thing. As educators in dental school, predoctoral and postgraduate, we don't really have to add any of this technology in the curriculum. You know, the CODA accreditation standard sets a bar for what every school needs to do. My decision of now incorporating technology in predoctoral education program like I've done in the past, but at a higher level here at Nova, is that let's just add a component of innovation to the treatment of patients. So all the courses that we implement technology on happens from the D1, that's the first year of dental school in predoctoral. And of course, in postgraduate education, all our programs have a more advanced technology. But why do we have to only have the technology in postgraduate education programs where we can actually spread that into an educational programs? Our predoctoral students will maybe become an advanced education program candidate or applicant, or they actually will go into practice. The idea behind this is, why don't we utilize technology to raise that bar? So by the time they come into practice, they're a different type of clinician rather than spending years in other CE programs. If we then implement technology early on in their programs, D3 and D4 for clinical, they be able to now incorporate those in their practice. Well, yeah, I think we in dentistry and prosthodontics have been looking forever to a solution to move away from an articulator and a face bowl. But we hadn't had access to, we got multiple photos, we stitched them together, but they distort points of reference. Technology that come in the market but are also gone, but also something that is accessible. We love implementing the RAYFace simply because it gives us a real 3D photo that actually can be manipulated in different softwares. But within the software, the RAYFace, I'm able to incorporate all those anatomical landmarks that makes that scanning precise. We're talking about cone beam CT scan, intraoral scan. So I'm now able to combine all this information and provide what we really look for, that RAYFace was able to give us, is a virtual patient. The hardest things that we've been looking for ages. Now, digital dentistry is not new, but the piece of the virtual patient was completely missing from all companies, and many companies have tried. So when we spotted the access to the RAYFace, and I actually was interested for some time now, but last ACP meeting, American College of Prosthodontics meeting in Austin, that's when I approached your booth. And then I got scanned myself and I look at the accuracy points. I was lucky to find that one of my dear colleagues and friends, Dean Bafiades, in my department, was also a spokesperson for your company. So that made it very easy to get that level of transition. So we did start with our postgrad education programs, but I made the decision that I don't want to keep this only at the postgrad. I want to make sure my pre-doctoral students have access to that on a daily basis. So I don't see facial technologies moving away. On the contrary, I see them growing and becoming even more relevant. I can scan my patient. I can now incorporate cone beam data, intraoral scans, and other information that will make my face scan more accurate to be relevant to the face of the patient and actually the morphology and anatomical features. Over here, I have on the screen my dear friend, Steve Wagner. Steve and I have worked very closely also with digital dentists, but he's also a mastermind. He gave me permission to use this when he came and visited in April. I had him scan with the RAYFace. So again, RAYFace is here and we love it. We will continue to incorporate it in many levels. We're looking forward to working with RAYFace with many other projects that you may want us to do. But I'm sure you saw the excitement with our students. That's really all that it matters, is that they find it useful, and they will be your best audience to judge it.
Awesome. Thank you so much. Thank you for having us.
Thank you, guys.